Hey again, Lake Charles. Russ Silver's your CBS Eye on the Lake guy. This is Doctor on Demand. This should be a familiar face. Lauren Pete here. She's a doctor of physical therapy. Okay, so this is kind of an impromptu session here. Last time we were talking with you, we were discussing blood flow restriction, and you can see that video if you like. And then when we finished that, you said there was another because I've been dealing with a little tennis elbow, which is kind of fun that we've been kind of using as a guinea pig. You were talking about it, another way to kind of treat this as well. What's this called?
So what I've been using is called trigger point dry needling.
I'm sorry, say it again.
Trigger point dry needling.
I heard the word needle in there.
Sure. Yes. Everyone gets a little apprehensive whenever you talk about needles. This is one of the most invasive techniques we use as physical therapists. We are puncturing the skin using very tiny monofilament needles. So there's nothing in the needle. So that's where the dry part comes in.
Gotcha.
So people are like, what is the dry part?
A hypodermic needle where you inject something in a store or whatever. This is just a needle.
Dry, just the needle.
Okay,
so we're not injecting anything. And there's lots of research behind that. We can get articles for the patients so that, if they have further questions, we can clarify. So we go in, find a trigger point, a myofascial pain point in a muscle. Okay, so you've got the muscle belly, and we're looking for a taut band, a tender spot in the muscle, something that refers pain somewhere else. So for instance, if I poke you here, you might say, I feel that all the way into my fingers.
Right.
That is a positive trigger point. And so people have that throughout their body. A lot of times we see people, their upper traps, their hamstring, all kinds. If it's a muscle, it can have a trigger point in it. Typically that trigger point means that muscle is in a dysfunction. So we need to take that muscle out of dysfunction.
So this is different from the blood flow restriction in the fact that was doing something on a cellular level.
Sure.
This is treating more the muscle. You said out of dysfunction. What do you mean by dysfunction?
Sometimes it's not being used. So muscles are there to be used, and we need to use them. If we don't use them, we lose them. So sometimes it's not being used. Sometimes it's overworked. And
it's being used too much.
Correct. Overworked and underpaid. We all know how that feels. So that muscle is overworked because another muscle might not be doing their job.
Right.
So more than one muscle can have a trigger point in there. So typically I do a whole treatment session surrounding multiple muscles, depending on the patient. Like we talked earlier, it's a one-on-one thing.
Right.
Making sure to specialize just for what the patient needs. But yes.
Okay, so I would be, the condition I have would be a candidate for this treatment as well.
Absolutely.
Would you do one or the other? Obviously, you wouldn't do them both at the same time, but would you treat them? How would that work?
So typically, we get to know the patients and we understand what a patient's able to tolerate and what they're not able to tolerate. I have done the blood flow restriction in a treatment session, and then turned around in that same treatment session, done the trigger point dry needling.
You mean the same day, like in the same hour? Okay.
Same day. And then we follow up with some like some ice or something.
Okay, well, let's try this. Let's just give this a shot, and I will ask you questions and kind of talk through it here. So the name of this, again, is called something dry needle.
Trigger point dry needling.
Trigger point dry needle.
I think you're going to start to get a little nervous, like most people do whenever they start to get needles near them.
Oh, I love needles. I think they're great.
So I kind of make sure to talk it through with the patient. At any point in time, if the patient does not feel it, they just change their mind, it's a simple process. We take it out.
I've had several injections over the years into this. So this is not going to be new for me. Okay,
perfect. So what I'm going to do is just clean the area. We've already talked about the consent and stuff
we did
stuff like that. So what I do is clean the area, and what I want to do is find a muscle. Muscle moves the different joints.
Okay.
So what we're going to do is...
How do you know which muscle to find?
So, for instance, your extensor wad, so your fingers...
Yes.
Move whenever you move certain muscles. So what I'm going to have you do is just move that first finger.
Okay.
Oh, no, this hand.
Oh, okay.
Move that first finger.
So you're feeling where that muscle is.
Feeling exactly where it is. And then through all my training, I know where the nerves are and what the muscle looks like.
Yeah.
Absolutely. Yeah. This is a very tiny needle. And so that's a larger muscle, and certainly relative to the needle.
Yeah.
So what we do is have multiple treatment sessions.
Okay.
We don't always stick it in the exact same spot. That's quite impossible. So we play around with it and see, okay, did it feel good right here? Did it feel good? Where did we get your release?
All right.
So you can take a break from that. What I'm going to do is put a little poke in here. That's pretty taut.
Thank you.
Okay, so a little poke,
I'm not
okay?
sure that was a compliment, was it?
No, it's good. It's tight. I could tell. So I just go in there a little bit. So what
I felt the tap like a straw. I don't feel anything right now at all. Anything.
Okay.
Now, okay, so when I look at this from watching TV shows, this looks like acupuncture.
Sure, that's probably the number one question that we get.
But this is different than acupuncture.
It is a different technique. Okay. So similar needles. So a lot of therapists use acupuncture needles, and this actually is an acupuncture needle, but different technique. So
same equipment, different technique.
Correct. Just because you have a calculator doesn't mean you're an accountant.
That's right.
So
that's a good analogy.
So yeah, what I'm trying to do is needle a muscle rather than a meridian or an energy flow. I don't do acupuncture, but I am strictly looking for the muscle belly.
Right.
So I'm going to stick a nose, okay?
Sure. And the theory is that by doing this, you're kind of, I don't want to say insulting the muscle, but you're drawing attention to the muscle. You're putting something in that's causing the body to pay attention to that area. Is that right?
Right. And so did you feel a little jump there?
Yeah, I did, actually.
So I'm looking for a local twitch response. When we get that twitch response, that's whenever I know, okay, this is a great area. That's where the research shows that you get the most benefit out of the trigger point dry needling if you get that twitch.
Can I describe what this feels like? This doesn't feel like a poke or a stick or a prick. This feels like there's a band around it. It feels like you put a rubber band around this. That's what it just.
It's almost like it's gonna.
It feels like tension. It doesn't feel. It's not painful for sure.
Sure.
But I can feel a little bit of here on my thumb, a little bit, and then a lot of just tension there. Is this good?
Absolutely. Okay. So next, what I will do. To me, that's the hardest part. Once you get the needle in, right where the muscle is, that is the hardest part, in my opinion.
Okay.
So what I would like to do next is connect you to electrical stimulation.
Good.
So nothing's on right now.
Dr. Frankenstein now.
My dad said, "Do you connect them to the jumper cables?"
To the right. That's right.
That's pretty much what it looks like.
So two little alligator clips are now.
Two little alligator clips.
And what am I going to experience now? It's going to surprise me.
Well, no, you are going to feel almost like a pulse. Okay, so it's going to kind of pulse like a heartbeat almost in there. Okay, it might jump. We might see some jumping here. I'm going to start turning it up.
Galvanic response.
Kind of.
Yeah.
Let's see.
Oh yeah, there we go.
got some jumping.
Can you see that?
Now, the higher we go out, the more contraction we'll get. I'm not looking to hurt you, but
you just gave my elbow.
And you should even feel it. Now,
I do.
What's the sensation? Is it tolerable? Is it too much? Can we stop there?
That's probably.
We'll leave it there.
It's not uncomfortable yet, but I can tell we're close to being uncomfortable. Yeah.
So typically leave this on for a little bit. So that's our twitch. That's what we're looking for.
I'm not doing this. This is not me doing some acting thing. This is electricity, I guess, right?
It's working through the needle. A lot of people have had the TENS units. People are familiar with those at-home TENS units.
Right.
It's little sticky pads you put on your back, your arm, your knee, wherever the pain is, and you turn up your little device, and it kind of has this tingly sensation that helps to block the pain. That's certainly something we do here as well, but this works through a needle rather than the little sticky pads that everyone is used to, directly into the muscle.
So it's not going through skin and the fat layers. It's going directly.
We're right in it, and as you can see, we're in a good spot. We're twitching.
Okay.
There's multiple techniques to use, multiple needles depending on the severity and such.
How long does this treatment go for?
So I typically tell people we have, honestly, it seems miraculous results after one treatment.
Really?
It's almost, as a physical therapist, and I love my evidence, sometimes I'm like, I don't know if it should have been that better that quick.
Yeah, you're right. You get a little suspicious.
Sure. People feel great. Right. Typically, we have great results. If we don't get good results with 4 treatment sessions, we need to try something else.
Okay,
we'll try something else, seeing what else.
So how long typically would you leave this doing what it's doing?
About 8 to 10 minutes,
right.
Or what you can tolerate.
So
sure,
it's getting a little intense.
Sure, I'm gonna turn it off for our purposes, and even if you just do a little bit, it still has the benefit.
Right.
So what I'm gonna do is disconnect you.
Okay.
And then what I'm gonna do?
Zero pain. It's an interesting sensation. I can certainly say that because no one's ever quite. I've never had anything done this before. I think most people have it, and removing that was less painful than like taking a splinter out.
Yeah, I mean, sometimes we have people who have a little bleeding. Like I said,
bleeding.
We are puncturing the skin. There is a chance for bruising. Most likely,
This is my TV elbow.
Oh, that's your TV elbow. Uh-oh, we have to get some makeup.
She's been in the industry for 20 minutes. She knows the terms already.
Yeah, so soreness is a probability. That's probably the number one thing that
just like if you worked out your body,
absolutely
work out your chest, the next day your chest is going to be tender. And
people are already hurting in that area, so they're okay with a little bit of soreness. The following day is when you get that really good relief.
Okay.
I mean, I've had people stand up from the table and say, wow, it already feels better.
That's fantastic.
And then it takes a couple of days for others.
So sometimes one session will do this, but if you go more than 4, you're thinking maybe that's not the solution then.
4 without any kind of results.
Right.
It's kind of insanity. You don't do the same thing over and over again expecting different results.
Now let's say that I were coming to see you for this particular condition, tennis elbow, this epilateral condylitis. Is it is this going to treat the pain or is this going to treat the cause of the pain, or both?
Both.
Well, if you treat the cause, you're treating the pain.
Correct.
Yeah.
So I don't want to just use the Band-Aid effect. We'll put a Band-Aid on. So in addition to the trigger point dry needling, we do different modalities, like you were seeing here with the stim, but we use exercise, strengthening, the blood flow restriction, strengthening, stretching. Home exercise program is going to get you the farthest.
And even techniques on how to lift.
Absolutely. Yeah. Oh, the mechanics behind everything you do here is the most important part.
She was making fun of me before we did this because I was saying that I really don't do, when I've seen people that they say, well, it's a repetitive injury. I don't really do anything repetitively, but you said I know immediately why. When you lift something, this way is when it hurts the most. You're lifting a suitcase or a sound case.
Sure.
But you said bring the shoulder back, that lowers the fulcrum. That's just physics.
Exactly. Yeah. It's all physics. Your muscles are pulleys and levers, and your joints are included in that. And that's my job, and that's why you see physical therapy. Exactly. Yeah. That's why you go to the physical therapist.
Okay, so enough about me and my dumb elbow. This can be used for what? Knee. What are other
headaches? So we've got a lot of people who come in cervicogenic headaches. We sit like this all day long.
Yeah.
So everything is shortened on the back. Everything's lengthened on the front. Now we need to fix that. Now, muscle tightening, strengthening, neuromuscular control of all of the postural exercises are important. But sometimes you get those headaches that just kind of wrap around and you don't understand why. It's certainly after a long day of work. What do we do for that? I can literally go in and poke those needles into those muscles on the back side of your head and help to relieve those cervicogenic headaches that are caused from the bad posture. We're texting all day, we're typing all day, gravity gets a hold of us, stuff like that. So the cervicogenic headache's been great. TMJ, stuff that therapists aren't normally known for. The TMJ, hurting in the jaw, that's due to clenching, also postural. And then the typical things, the rotator cuff, the rehab of getting your shoulder feeling better, your ankle pain, your calf tightness, any muscle, most muscles can be needled with the trigger point dry needling.
So it really is. It's just one more tool in the toolbox.
Absolutely.
Yeah. That's fascinating. And how much training goes into being able to recognize these things?
So in order to not all therapists do the trigger point dry needling. You have to have a separate course. In the state of Louisiana, I believe you have to have 50 additional hours of just trigger point dry needling prior to being able to needle on a patient. So it was a separate course, multiple weekends in a row, and really getting a feel for the muscles and kind of taking you back to that anatomy. Which we learned in physical therapy school.
The muscle, the insertion, the action.
Exactly. All of those things. And then being able to implement it. So obviously having a physical therapy license is another positive.
So maybe not something like arthritis, but certainly muscular things for sure.
Absolutely.
And even those headaches can be caused by muscular.
Arthritis is typically caused by a wear and tear on your body. So your body will adapt to the change in which you put it under. The problem is people put their bodies under certain changes and certain pressures that it's not really meant to be under, but it will change your body, not necessarily in the best way. That's where you get that arthritis. If you take those muscles and get those muscles activating to take the pressure off of the joint, then you can eliminate the progression of the arthritis.
So in the beginning, some muscles are overworked, some are underworked. You want to try to spread that load out of you.
Absolutely. When everybody shows up to work, everyone's happy.
Yeah, is that right?
Yeah, right?
Nobody wants people I work with. Excellent. So if they want to set up some of these treatments and find out if this treatment is right for them, then what do you do?
So they give us a call. Just like we were saying in our last video, having the direct access in the state of Louisiana is wonderful. We found it being great. You don't have to wait to get into the doctor. You don't have to, you don't have to call them, wait to get into them, and then they call and say that you need physical therapy. You can call us directly at the office. Tell us about what's going on. We can get you set up for your initial evaluation. If we see any red flags from there, we certainly will refer you to the person that you need to be seen. Otherwise, we hit the ground running and get you feeling better.
Right, or at least hit the ground. Okay, I purposely taken a little bit longer here because I wanted to kind of see the results here. There is zero bleeding. I can't even tell where the needles had gone in. I don't see any bruising.
How do you feel?
If I could shake your hand, that's when it really hurts. Yeah, it seems to have alleviated that pain. That's where it comes from gripping things and like you said, lifting things this way is really tough.
Really gets it.
Excellent. So this is when you everybody loves getting a massage. When you massage, you have fingers, digital fingers going in and kind of stimulating the muscles. This is not unlike that, but instead of fingers going through skin, it's directly in the muscle, and instead of fingers, it's electrons, I guess.
Correct, and it's a needle. So your finger, your surface area is a lot larger than a needle, and so I tell people, it's not quite as aggressive as somebody really gets in with their thumb and they poke you. Sometimes the massage therapist will really dig in there, and that's what it needs to get released. But this is a little bit more tolerable if you can get past the needle part of it.
Some people are terrified of needles.
Sure, and then there's plenty of other techniques that we can do to still get your pain reduced.
But I'm sold.
Yeah.
Excellent.
Come and see me.
Be healthy. Thank you for joining us.
Thank you so much.
This is Lauren Pitre. She is a doctor of physical therapy here at MAXX Physical Therapy. And I'm Russ Silvers, your CBS Analytic guy. And I'm going to go lift something ridiculously heavy now.
Thank you.